According to a 2020 report by the Substance Abuse and Mental Health Services Administration, around 7% of New Mexicans have a substance use disorder. Philip Fiuti is a technical advisor at the New Mexico Department of Health's Harm Reduction Program. He said that his journey into harm reduction began almost 40 years ago during the HIV epidemic.
One of my best friends who was fine one day was not fine the next day, and very shortly thereafter passed away from AIDS. And there were no services or anything at that time, and so a whole bunch of us, I don't know, sort of the message I think that we were getting from the world at large at the time was that we should all just go away and die. And so we began trying to copy interventions and things that we had read about that were like happening in Europe, which included getting a hold of syringes and distributing them. We even got a hold of naloxone in the early 90s and started using it in our community and everything. And that I had no idea at the time that it was going to become something somewhat of a career choice.
According to the New Mexico Department of Health, in 2019, 74% of all overdose deaths in New Mexico involved opioids. Josh Swatek is the Harm Reduction Program Manager. He said that to prevent incidents of overdose, a multifaceted approach is needed.
Pieces of our program include what people think of like a syringe exchange programs, where we provide clean and sterile equipment to avoid things like bloodborne pathogens. We provide naloxone so that people can reverse an opioid overdose. We provide education on how to reduce the likelihood of overdoses. Harm reduction overall has been well researched, and it's been shown that harm reduction is a successful method of making folks more likely to get into treatment, and when they get into treatment, more likely to succeed.
Harm reduction service is just one aspect of battling the opioid epidemic. And for Tanika Sosa Gonzalez, a board-certified psychiatric mental health nurse, Las Cruces has a long way to go in terms of treating those suffering from substance abuse disorders.
I think that services that we have are not necessarily fully targeted at areas where we need them the most. We have a really, really high rate of youth and adolescents right now that are struggling and need support. There's not a lot of support for those kids other than inpatient hospitalization. There's a lot of challenges when it comes to finding outpatient care. And I think we see that even in the professional world amongst especially healthcare providers. We are even middle-class people with health insurance. If you try to find a counselor, it can be incredibly difficult. There can be really long wait times to find someone when you need a prescriber. And there are even fewer resources if you have a substance use disorder.
According to the CDC, in 2021, New Mexico had one of the highest rates of suicide in the U.S. and ranked in the top 10 in drug overdose mortality. These numbers are part of the reason why Sosa Gonzalez says that there needs to be more resources in the state for those struggling.
Resources need to be available regardless of people's ability to pay. And resources should be available everywhere, not just in Albuquerque, not just in Santa Fe, not just in Las Cruces. Resources need to be available to everyone statewide. I also think that I would really ask that legislators mandate for providers continuing education on stigma and on person-first language, and to really revisit and understand the disease process that we're looking at.
Cassandra Gondara is Mayor Pro Tem in Las Cruces and founder of the Las Cruces Suicide Prevention Task Force. She said that the task force works with other organizations to help address substance abuse and mental health issues in the community.
So we've been working on educating the public about suicide, signs and symptoms, how to talk to somebody that is contemplating suicide, meaning, safety planning with one, and being able to link and refer.
When asked about the closure of Memorial Medical Psychiatric Ward and the constant delays in getting it back open, Gondara said that she understands the public's frustration and that conversations are being had between the city, county, and executives of Memorial Medical.
The worst thing we can do is just open something up with not having the infrastructure in place and then having to close it down. And so we want to do it right, and I'm trusting that the peak alongside the Memorial Medical executive, staff is doing what they can as quickly as they can to get this up and running.
Gundata said that the target date for Memorial Psychiatric Ward to open is now in July. When KRWG reached out to Memorial Medical to confirm this, we did not receive a response. For KRWG Public Media, I'm Jonny Coker.